If you've ever whispered this question to yourself and immediately felt embarrassed for even thinking it, listen to me closely. I'm Dr. Rachel Moore, and I see this exact situation in my office more often than you might imagine. Why does it hurt for me when other women say it doesn't? I want to be very clear from the first 5 seconds. Pain is not a requirement, and suffering is not a duty. And if anyone ever told you otherwise, they were wrong. Let me tell you about a patient I saw not long ago. She sat across from me, hands tightly clasped, eyes fixed on the floor. Her voice dropped to a whisper when she finally spoke. "Doctor, is it normal that it hurts every time?" I asked her a simple question back. "Did you feel safe enough to stop when it hurt?" She hesitated. That pause told me everything. Here's the truth most women never hear explained properly. When pain shows up in sex, especially anal sex, it's not random, and it's not because your body is defective. There is always a reason. A physical one, an emotional one, or very often, both. I'm not here to scare you. I'm here to decode what your body is trying to tell you. Every week, I treat women who come in convinced something is wrong with them. They've read comments online. They've heard friends talk casually about pleasure, as if discomfort is just a phase you're supposed to push through. Some even apologize to me before explaining what happened, as if their pain is an inconvenience. Let me say this out loud. As your doctor, pain is communication. And when we ignore it, the consequences don't disappear. They multiply. Now, I want you to stay with me because in a moment I'm going to explain why two women can have the same experience and completely different outcomes. But first, I need you to understand one thing I tell every patient face to face. Your body is not silent. We just haven't been taught how to listen. One woman once said to me, almost jokingly, "Maybe I'm just too tense." I smiled gently and answered, "Or maybe your body is protecting you." That surprised her. It surprises a lot of women. The problem is that culturally, we've learned to associate endurance with maturity, as if being a modern woman means overriding discomfort. But medicine doesn't work like that. Anatomy doesn't work like that. And your nervous system certainly doesn't work like that. Here's something I want you to really absorb. Not all bodies experience sensation the same way. And that difference alone explains more than half of the confusion around this topic. Before we begin, make sure to like this video and subscribe because there are important things about your body and your intimate health that very few people explain, and you deserve to know them before anyone else. I've had patients who tried once and felt immediate pain, others who felt nothing at all, others who felt pressure that turned into anxiety before it turned into pain, and yes, some who experienced pleasure. All of them real, all of them valid. But here's where things get interesting and where most explanations stop short. Pain doesn't mean you failed. It doesn't mean you didn't relax enough. And it certainly doesn't mean you're obligated to try again until it stops. I remember another patient, early 30s, confident, well-informed in many areas of her health. She looked me straight in the eyes and said, "I thought something was wrong with me because everyone else makes it sound easy." That sentence is the quiet damage of misinformation. What I need you to know right now is this. There is a medical explanation for why it hurts for some women and not for others. And once you understand it, the shame dissolves. The pressure eases. And suddenly, you're no longer blaming yourself. In the next part, I'm going to walk you through what I see in the body itself, what's happening anatomically, why relaxation alone isn't the full answer, and why the phrase, "just get used to it," is one of the most dangerous myths in women's sexual health. Stay with me, because once you understand what's really happening inside your body, everything you've been told up to now will start to make a lot more sense. When a woman sits in front of me and says, "Doctor, I feel like my body betrayed me," I almost always respond the same way. Your body didn't betray you. It tried to protect you. This is where guilt begins to dissolve, when we stop treating the body like an enemy and start understanding how it actually works. Let me explain this the same way I do in my office, without medical jargon, without lectures, just honesty. I usually start by asking a simple question. Do you know the difference between how the vagina and the anus are designed? Most women shake their heads. So I take a pen, draw two simple shapes on a notepad, and say, these two areas are neighbors, but they're built for completely different jobs. The vagina is designed for penetration. Its tissue is elastic. It lubricates naturally when aroused. It adapts. It opens gradually. It's forgiving. When the body feels safe, it knows what to do. The anal canal is different, very different. It's protected by muscles called sphincters. Their natural reflex is not to open, it's to close. They exist to hold, not to receive. And they listen closely to the nervous system. Fear, tension, hesitation, even distraction can make them tighten without you consciously deciding anything. I can't tell you how many times I've heard, but I was relaxed, at least I thought I was. That sentence always breaks my heart a little, because relaxation isn't just a thought. It's a physical state. And for many women, their body never fully enters it during this experience, especially if there's pressure, expectation, or uncertainty involved. I once had a patient say, I didn't want to disappoint him, so I told myself I was fine. Her body didn't agree. Here's what I see clinically: women blaming themselves for reactions that are entirely physiological. The skin inside the anal canal is thinner. It's more fragile. It doesn't have the same natural defenses. Even minimal friction can feel intense if the tissue isn't prepared properly. And preparation isn't just about technique. It's about trust, time, and the nervous system feeling safe. When I explain this, many women exhale for the first time. One actually said, "So I'm not broken?" I smiled and said, "Not even close." But here's where the confusion deepens and where the second question always comes up. Then why do some women say they enjoy it? That's when I lean back slightly and say, let's talk about variability. Human bodies are not identical machines. Nerve distribution varies. Muscle tone varies. Sensitivity varies. Emotional associations vary. Even past experiences, positive or negative, can change how the body responds. Some women have nerve patterns that register stimulation in that area as pleasurable. Some experience indirect stimulation of internal structures. Some associate the experience with novelty or intimacy, which amplifies arousal. And for them, under the right conditions, it can feel good. But, and this is critical, that does not mean their experience is the standard. I've seen women chase a version of pleasure that simply isn't written into their bodies. And the damage doesn't come from the attempt. It comes from ignoring discomfort to force a result. One patient said to me, I thought if I tried harder, my body would eventually get used to it. I answered very gently, your body doesn't need training. It needs respect. Another common mistake I see is comparing pain thresholds. Pain is not a competition. Feeling pain sooner doesn't make you weak. Feeling pleasure doesn't make someone else superior. These comparisons create shame where none belongs. I also need to address something I see far too often: women who confuse pressure with consent. They say things like, I didn't want to say no, or he said it would feel better next time. That's not how anatomy works. Muscles don't relax because of promises. Tissue doesn't adapt because of pressure. The body responds to safety, patience, and choice. And here's something I tell every patient very clearly: the absence of desire is not something to fix. If your body resists, it may not be fear. It may simply be preference. And preferences are not disorders. At this point in the conversation, I usually pause and ask, does this sound familiar? Most nod quietly. That's when I explain the biggest misconception of all. Pain is not something you push through to reach pleasure. Pain is the signal that something is misaligned physically, emotionally, or both. Some women feel relief hearing this. Others feel anger. Why didn't anyone tell me this sooner? One asked me. That question lingers. Because the silence around women's pain teaches them to internalize blame, to believe they're doing something wrong, to think discomfort is the price of intimacy. It isn't. Before we move on, I want you to hold on to this idea. Difference does not mean deficiency. In the next part, I'm going to explain when discomfort crosses the line into danger and why ignoring certain signals can lead to problems far beyond a bad experience. And then, because I don't believe in leaving you with fear, I'll show you how understanding your body changes everything. There's a moment in many consultations when my tone changes, even if my voice stays calm. It's when I look at a patient and realize she has been tolerating something her body has been warning her about for a long time. She'll say things like, "It hurts, but only sometimes," or "It bleeds a little, but it goes away," or my least favorite sentence of all, "I thought that was just part of it." That's when I lean forward and say, very clearly, this is where we need to talk seriously. Because discomfort and danger are not the same thing, and confusing them can have consequences that don't show up immediately. Let me tell you about a woman I treated a few years ago. Early 40s, calm, articulate. She didn't come in because of sex-related pain. She came in because she had started feeling burning and pressure every time she went to the bathroom. At first, she ignored it. Then came small traces of blood. Still, she waited. When I asked how long this had been happening, she said, "A few months." A few months. What she didn't realize was that what started as minor discomfort had turned into a chronic anal fissure. Something that could have healed easily if addressed early had become a long-term problem requiring treatment, patience, and a lot of emotional distress. When I explained this to her, she looked stunned and said, "But I thought pain was normal." This is the moment I want to pause with you. Pain that fades quickly and doesn't return is one thing. Pain that repeats, intensifies, bleeds, or lingers is something else entirely. In my clinical experience, the most dangerous thing is not the practice itself. It's the silence around symptoms. I've treated women who ignored sharp pain because they didn't want to seem dramatic. Women who had bleeding because they were ashamed to explain what led to it. Women who normalized symptoms that should have sent them to a doctor weeks earlier. And here's the truth I need you to hear. Your body escalates when it's ignored. Small tears become deeper. Inflammation becomes infection. Muscle spasms become chronic pain patterns. What could have been resolved with rest and guidance turns into something that affects daily life. I remember one patient asking me, almost defensively, "Are you saying I should be afraid?" I answered, "No. I'm saying you should be informed." Fear paralyzes. Information protects. Here are the warning signs I see most often when discomfort has crossed into risk. Pain that feels sharp rather than pressure. Pain that doesn't ease after stopping. Visible bleeding. A burning sensation that lasts hours or days. Or a feeling that something simply isn't right afterward. None of these are punishments. They're signals. Another patient once told me, "I didn't want to make a big deal out of it." I replied, "Your health is the deal." What makes this topic even more delicate is that many women are taught to endure, to tolerate, to adjust themselves to situations rather than adjust the situation to their bodies. That mindset works against you here. Medically speaking, the anal canal is vulnerable to microinjuries. The tissue heals slowly when repeatedly irritated. And because the area has a high concentration of nerves, pain signals can become amplified over time. Ignoring that doesn't make you stronger. It makes the problem quieter until it's not. I've also seen women come in with recurrent infections, confused about why they keep returning. When we talk through their history, a pattern emerges that no one explained to them properly. Again, it's not about judgment. It's about missing information. Silence creates risk. Knowledge creates options. At this point in the consultation, many women ask me, "Why didn't anyone tell me this before?" I don't have a satisfying answer, but I do have responsibility to tell you now. There's something else I want to address because it often goes unspoken. Emotional discomfort matters too. If your body tenses before anything even happens, if your mind races, if you feel dread instead of curiosity, that's not something to override. That's your nervous system signaling that it doesn't feel safe. And safety is not negotiable in any medical context, including sexual health. One woman once said to me, "I thought if I didn't say yes, something was wrong with me." I looked her in the eye and said, "Something is wrong when you feel you can't say no." Pain doesn't just show up in tissue. It shows up in patterns of avoidance, anxiety, and self-doubt. When we ignore it long enough, it stops being a moment and becomes a memory the body holds on to. I'm telling you all of this not to alarm you, but to give you clarity. Because clarity is the opposite of shame. And here's the part that most women don't expect. Risk doesn't mean inevitability. There are ways to protect yourself. There are ways to make informed decisions. There are ways to listen to your body without fear. In the next part, I'm going to explain exactly how women reduce risk, set boundaries without guilt, and make choices that align with their bodies instead of fighting them. Because understanding danger is only half the story. The other half is knowing you have control. When I reach this point in a consultation, I usually soften my voice, not because the topic is lighter, but because this is where relief begins. This is where women realize they're not broken, not late, not failing at anything. They're simply learning how to listen to themselves. So let me speak to you the same way I speak to my patients, directly and honestly. First, boundaries are not obstacles to intimacy. They're requirements for safety. If something causes pain, discomfort, fear, or emotional shutdown, that is your body setting a boundary for you. You don't need to justify it. You don't need to negotiate it. You don't need to explain it with perfect words. A woman once asked me, "How do I say no without ruining the moment?" I answered, if saying no ruins the moment wasn't safe to begin with. Second, communication is not optional, it's preparation. Real communication means being able to pause, stop, change your mind, or say, "Not today," without consequences. It means checking in with yourself as much as with your partner. And yes, it means believing yourself when your body answers before your mouth does. Now let's talk about preparation in practical terms, because clarity removes fear. If a woman decides she wants to explore, it must be slow, intentional, and never rushed. The body needs time. The nervous system needs reassurance. Lubrication is essential, not negotiable. Protection matters not just for hygiene, but for health. And progress, if it happens at all, happens gradually. But I want to be very clear about something. Deciding not to explore is also a complete decision. There is nothing immature, conservative, or closed-minded about knowing what you don't want. Preference is not something to overcome. It's something to respect. One patient said to me, "I thought I was supposed to want this eventually." I smiled and replied, "Supposed to according to whom?" Here are the signs I always tell women to watch for, signals that mean you stop immediately and seek help if needed. Sharp pain instead of pressure, bleeding that doesn't resolve quickly, pain that lingers for hours or days, fever, burning, or a sense that something changed afterward. These are not inconveniences. They're messages. And please hear this clearly. There is no award for endurance. There is only health, or the cost of ignoring it. I also want to address the emotional side one last time. If your body tenses before anything even happens, if your thoughts race, if you feel dread instead of curiosity, that matters. Emotional safety is part of physical safety. Your nervous system doesn't separate the two. Over the years, I've seen something beautiful happen when women replace guilt with understanding. They stop apologizing for their bodies. They stop forcing themselves into narratives that don't fit. They start asking better questions, not "what's wrong with me," but "what does my body need?" That shift changes everything. Let me take you back to the question we started with. Why does it hurt for some women and not for others? The answer is simpler than you were ever led to believe. Pain doesn't define the woman. Information defines safety. Understanding creates choice. And choice is where empowerment lives. Before I finish, I want to prepare you for what comes next. Because this topic doesn't exist in isolation. There are other silent mistakes women make in their intimate lives, small ones, repeated over time, that create pain, frustration, and distance without warning signs. Things no one explains until something goes wrong. That's what I'll be talking about next. If this conversation gave you clarity you've never had before, I invite you to subscribe to the channel so you don't miss what's coming. If you have a question you've never felt comfortable asking, leave it in the comments. I read them and I take them seriously. And when you're ready, watch the next video where we continue unpacking what women deserve to know about their bodies. I'm Dr. Rachel Moore, and your body deserves understanding, not silence. If you've made it this far, leave a like and subscribe now, because when it comes to your intimate health, having the right information at the right time can make all the difference.